Mr. Chairman,
we now have not only a quorum, but all members of the committee are present. I move that the committee favorably report the nomination of the Honorable Robert F. Kennedy, Jr. of California to be Secretary of Health and Human Services. Is there a second?
Second.
There is a second. The clerk will call the roll.
Mr. Grassley.
Aye.
Mr. Grassley, aye. Mr. Cornyn.
Aye.
Mr. Cornyn, aye.
No.
Ms. Smith, no. Mr. Lujan.
No.
Mr. Lujan, no. Mr. Warnock.
No.
Mr. Warnock, no. Mr. Welch.
No.
Mr. Welch, no. Mr. Chairman.
Aye.
Chairman votes aye. Mr. Chairman, the final tally is 14 ayes, 13 nays.
Donald Trump said that he was going to allow Mr. Robert Kennedy to, quote, go wild on health. Go wild. Of all the things that I can think of that I'd like to see a Secretary of Health and Human Services do, go wild is not on the list. Mr. Robert Kennedy is manifestly unqualified for the job he seeks. And in both my live and written questions for the record, he failed to commit to protecting access to affordable health care. He's unqualified, and I dare say everybody here knows it. We need a serious person at the helm of the HHS, an agency responsible for about half of the health of about half of all Americans. Mr. Kennedy appears more obsessed in chasing conspiracy theories than chasing solutions to lower health care costs for working families in Georgia and to make sure that we are protected. The last thing we need is a dilettante dabbling in conspiracy theories at HHS.
I hope he goes wild and actually finds a way to reduce the cost of health care. I hope he goes wild, and instead of having the discussions that we have had for the 10 years that I've been in the Senate of making Medicaid work and making people on Medicaid healthier, I hope he goes wild and figures out how to do it, because the status quo has not achieved much in
And anybody who actually goes and looks at that podcast and will see this. He asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective. And I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right, so
he interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden, so bringing this up right now is dishonest.
let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021, you petitioned the Food and Drug Administration to not only block Americans from having access to the COVID vaccine, but to prevent any future access to the life-saving vaccine. Are you denying that? Your name is on the petition.
We brought that petition after CDC recommended the COVID vaccine without any scientific basis for 6-year-old children. I'm going to require, and first of all, anybody who wants to take a vaccine, I'm not going to get in their way. If you want a vaccine, or if you want to vaccinate your children, those vaccines will be available. But I am going to tell the truth to Americans, and I'm going to do for the first time good science, right? When I was a kid, there were 3 vaccines, and I took all 3. There were 3 that were mandatory, that were recommended, which essentially means mandatory, and I was compliant. Today there are 72, and we're going up to now, I think, 77 or 79 with the annual COVID vaccines. So, and not one of those, with the exception of the COVID vaccine, not one of those vaccines has been tested prior to licensure in placebo-controlled trials, which are required for every other medication. So what I would do as president is I would require placebo-controlled trials, long-term safety trials that will look at efficacy, will look at safety, will look at the long-term impacts, and be able to inform Americans for every age cohort whether that vaccine is likely to avert more problems than it causes for individuals. And I think everybody ought to have that choice.